How did we do this? We used the technology to make care more proactive, so that before someone comes in for a visit to the doctor, all the tests have been done. The doctor has the test information. The patient has the test information. So the visit is not about asking questions and doing tests. The visit with the doctor is about solving problems and then following up afterwards. You see the iPhone here. On my iPhone, I have an app. I can hit it, enter my unique identifier. I have access to my medical record. I can have secure messaging, not just open email, but secure messaging to my doctor. I can make appointments, refill prescriptions, and I can ask questions about my health and get that information. 9 million members have access to their medical records in that way. But the medical record is also used with what we call smart sets, so that for any particular thing that the doctor wants to know or go deeper on, in this case, physical activity by a person, which we use as a vital sign, it's pre-populated, and the doctor can punch this up, get information about what the standard of care is, and then enter information. All of that content was generated by our doctors. We don't have administrators do this for doctors. The doctors generate it. We put it into the system. So part of what this means by proactive is, if a woman comes into one of our offices or hospitals for a broken ankle or a sprained ankle, her record will be pulled up. She will be asked, have you had your mammogram? If she has not had her mammogram and she's in the age category where she should, she will be offered an appointment. Most people say, sure, I'll take care of that. We say, no, let me make the appointment right now. Go across the hall and you can get your mammogram once we give you crutches so that you can get there. That's proactive. The result is 95% of the women in Kaiser Permanente have been screened according to schedule with a mammogram. And we do that for every preventive care measure. So we make the care proactive. You may contact us for one thing. We try to make sure that all of the other things are available to you. This electronic health record has also proved very valuable to us already in pandemic and disaster. When H1N1 hit, we were able to push through the record to every doctor in our system the latest approach to diagnosis, the latest priorities for treatment, and approaches to prophylaxis and prevention, so that they were absolutely current on what they were seeing and what to do. When we had terrible wildfires in Southern California 2 years ago, we were able to reach all of many of our facilities were closed because of fire or the roads were blocked. We were able to reach our members, make their appointments at another facility, and when they arrived there, their record was already there because it was an electronic record. I had the experience this week of talking with several doctors who talked about how they had to interview every single person who was resettled to find out what medications did they have, what conditions did they have, and so forth. This enables you to move rapidly past that kind of circumstance so that that information remains. This is not simply information for the doctor, I want to emphasize. For us, it is critical that the patient have the information all of the time and be able to ask questions about it. So we began first with simply making information available electronically. An encyclopedia of drugs and health conditions, a directory of facilities, and so forth. We then moved to add the capabilities that I just spoke about, emailing your doctor, getting your lab tests, explanations of them, prescriptions, and so forth. And now we move to this additional category where we are remotely beginning to monitor blood pressure, weight, glucose, and so forth. Now this makes an amazing difference in what happens. So all of these things that someone used to have to come to the doctor for, take a day away from work or away from children, come to the doctor, wait in line, see somebody, get a test, come back, get information later, now can be handled without that visit having to happen in person. So we have found that our visits have gone progressively down, but the number of contacts we have with our patients has gone up and up because of this additional capability. We also focused on simple, inexpensive measures, proven and based in the evidence, that would have the greatest effect on the most important conditions. So the bundling of aspirin, a generic cholesterol drug, and a generic blood pressure medication for patients at risk of cardiovascular disease, particularly diabetics, we have now used throughout our system and are sharing with others. It is very low-cost intervention, proving to have very high results in terms of preventing heart attack and stroke. We also have focused on empowering our workers at the front line, not only our physicians, but our nurses and aides and assistants as well. This is a simple example when we set out to find out how could we eliminate medication errors in the hospital. We studied this for a considerable amount of time and concluded that what the nurses had told us all along was the major factor. Being interrupted by someone while you're drawing a medication is the commonest cause of a medication error. There are other things like bottles that look alike and so forth. So the nurses, the first one, put a sign on her that said, "Don't interrupt me." Over time, that evolved to what we use now, the neon sash. So when a nurse is doing a medication draw, she does that. Simple activity, big difference in terms of a major cause of hospital-acquired problems. Down below is an innovation center that we developed where we purchased a very large warehouse, and we can outfit it like a nurse's station in a hospital, like a doctor's office in a clinic, like a laboratory, like anything, to test new equipments, but also to let our workers come in and identify new ways of doing these things. So part of the message that I want to leave with you is it's not all high technology. It is also empowering the people who give the care every day to develop their own critical solutions. So what's the result of all of that? We are leading in America in prevention in every market and every community we are in. And we are leading in the United States. This is a recent ranking of 341 plans that serve the elderly in America. Our 8 plans scored 1, 2, 3, 4, 7, and so forth. So you see, in many ways, we've achieved a very high level of quality. But we've concluded that that is not nearly enough. Because what happens in the doctor's office and the hospital is really only a small part of what shapes people's health. Behavior, family history and genetics, and environmental factors have a huge effect on that. 4 what we call default behaviors or modifiable risk factors shape most chronic disease. Inactivity and poor nutrition, the abuse of alcohol, tobacco, still, after all we know, and salt. We could probably add stress to these, as was pointed out earlier. In order to address these things, we have to go well outside our offices into the community. In addition to that, we have the disparities that are created by lack of equity in the society. These are 3 maps of the San Francisco Bay Area. The first, the darker the area, the lower the income. The second, this is diabetes. The darker the higher the concentration of diabetes. The third, childhood obesity. The darker, the higher the prevalence of childhood obesity. This is not the entire population of the Bay Area. These are the members of Kaiser Permanente. They have the same coverage, the same doctors, the same access to care, the same protocols and guidelines are followed, and yet we see striking differences based on where people live. So we have to be able to address that as well. For us, that means an approach that we call total health. Thinking of this morning's earlier presentation, that begins, with integrated medical, physical, and behavioral health, but then includes interventions in each of these other spheres of life that can shape people's health. That's been reflected in a number of examples that I won't dwell on. Our Everybody Walk campaign harnesses the simple idea that people walking 30 minutes a day briskly have a significantly reduced level of diabetes, heart disease, cancer. Now it appears it affects the prevalence of Alzheimer's and other things as well. Almost everyone can do it. It's easily done and built into a day's routine, and it doesn't cost anything. An extensive program of interventions in communities to change work sites, change the design of communities, and change what happens in schools. And finally, an aggressive program of environmental safety and environmental stewardship. We have eliminated mercury from our hospitals. We are systematically eliminating PVC and other toxic chemicals. We have recently switched out all of our tubing and plastic products from things that we now believe are endocrine disruptors and are toxic to people. We focus on conserving energy, on sustainable food, on reducing waste, and on the conservation of water. Now, many people might say, why is a healthcare organization doing that? Because healthcare organizations use more toxic products, generate more waste, and create more environmental hazard than almost anyone is willing to recognize. So if we are accountable for people's health, we have to be accountable for our impact on the environment. Let me turn finally to some reflections on my visit of the last week. And I do this with great respect for all the work that you and so many other people are doing in the recovery, and for my own ignorance of the people and communities and organizations that I was working with. We visited the affected areas in Miyagi, Iwate, and Fukushima, and we listened to the stories and ideas of doctors, university professors and deans, government officials, and others. We exchanged ideas. And as I said at the outset, everywhere we went, we found dedicated people working hard to solve the problems that were right in front of them as they saw those problems. We also encountered a number of young people with extraordinary energy and creativity who had been involved since the first day, who have great ideas. They are in the bureaucracy, they are in the medical centers, they are in communities, and I believe they need your encouragement to think big and to unleash their creativity. They see that you have an opportunity here to do even more than solve the immediate problems, as huge as those problems are. Yes, you have an urgent situation, but you have resources, you have money, you have technology. You can rebuild and redesign at the same time if you choose to do that.